Heart failure warning, 10 silent signs you must not ignore. As we age, heart health becomes an increasingly important concern, especially after age 50. While many people believe heart disease symptoms are obvious, like severe chest pain or a dramatic collapse, the reality is that heart damage often develops silently. Some of the earliest signs of heart failure, clogged arteries, or cardiovascular disease are so subtle that they can be overlooked for years. If you're in your 50s or older, recognizing these silent heart disease symptoms could be crucial for heart attack prevention and long-term cardiovascular health. Many individuals may have symptoms of heart failure or early signs of heart damage without realizing it. By paying attention to these unexpected heart symptoms, you can take action before it's too late. Heart failure warning. 10 silent signs you must not ignore. 1. Calf swelling or pain. A sign of peripheral artery disease PED. Have you ever noticed unusual calf swelling, cramping, or pain after walking or climbing stairs? While it might seem like a minor discomfort, it could be a warning sign of peripheral artery disease PAD, a condition where plaque builds up in your arteries, restricting blood flow to your legs. PAD is strongly linked to clogged arteries and heart disease, making it more than just a circulation issue. Over time, narrowed arteries can limit oxygen supply to your muscles, leading to persistent leg pain when walking, claudication, swelling in the lower legs, ankles, or feet, a feeling of heaviness or fatigue in the legs, cold feet, or slow-healing sores on the lower limbs. Ignoring this symptom can be dangerous. Advanced PAD increases the risk of heart attack, stroke, and even limb amputation in severe cases. If you experience calf pain or swelling regularly, don't assume it's just aging. Talk to your doctor about your cardiovascular health. 2. Bleeding gums and gum disease, a hidden heart disease risk. You might think bleeding gums are just a minor dental issue, but did you know they can be an early indicator of heart disease symptoms? Research shows that poor oral health is directly linked to cardiovascular health, as bacteria from inflamed gums can enter the bloodstream and contribute to arterial plaque buildup. If you're experiencing persistent gum inflammation, bad breath, or gum recession, this could be a sign of chronic inflammation, which is a major factor in heart failure symptoms. Increased risk of clogged arteries, leading to restricted blood flow. Elevated stroke warning signs due to poor circulation and blood vessel damage. Taking care of your oral health is about more than just your teeth. It's essential for heart attack prevention after age 50. Regular dental checkups, daily flossing, and an anti-inflammatory diet can help lower your risk. 3. Snoring or sleep apnea. A silent threat to heart health. Loud, persistent snoring may seem like a simple annoyance, but if it's accompanied by pauses in breathing during sleep, you could have sleep apnea, a serious condition that strains your heart. Sleep apnea causes repeated interruptions in breathing, leading to low oxygen levels, which force the heart to work harder. Higher blood pressure, increasing the risk of heart failure symptoms. Irregular heartbeats, a major risk factor for stroke and heart attacks. People with undiagnosed sleep apnea have a significantly higher risk of heart disease and silent heart disease progression. If you wake up gasping for air, feel extremely tired during the day, or suffer from frequent morning headaches, get evaluated by a sleep specialist. Using a CPAP machine or losing weight can dramatically reduce symptoms and protect your heart health. 4. Sudden extreme weakness, a possible heart failure warning sign. Have you ever felt a sudden, overwhelming weakness or fatigue that makes even simple tasks feel impossible? Unlike regular tiredness, this type of exhaustion can strike suddenly and doesn't improve with rest. It's one of the early signs of heart failure, indicating that your heart is struggling to pump blood efficiently. Common symptoms of heart failure that accompany weakness include shortness of breath, even with mild exertion, dizziness or lightheadedness, especially when standing up, chest pain or discomfort, signaling heart strain. If you experience these heart failure symptoms, don't dismiss them as just aging or stress. Seek medical attention immediately, as extreme fatigue can be a precursor to heart attacks or strokes. 5. Skin rashes or unusual spots, a sign of inflammation and heart disease. Your skin might hold clues about your cardiovascular health. Chronic skin conditions like psoriasis or eczema can indicate inflammation, which plays a major role in clogged arteries and atherosclerosis. People with psoriasis are at a higher risk of heart disease due to the body's persistent inflammatory response. If you have red, scaly patches that don't heal, sudden skin discoloration or rashes, slow healing wounds, especially on the legs, it's time to check in with a doctor. Managing inflammation through diet, stress reduction, and medical care can protect both your skin and your heart. 6. Unexplained nausea or indigestion, a lesser-known heart attack warning sign. We often associate nausea and bloating with digestive issues, but did you know that heart problems can mimic acid reflux or indigestion? Women, in particular, often experience unexplained nausea as an early sign of a heart attack. If nausea is accompanied by dizziness or cold sweats, chest discomfort or jaw pain, shortness of breath, seek medical help immediately, as these could be heart attack warning signs. 7. Persistent hoarseness or chronic cough. Could it be heart failure? A lingering dry cough that worsens at night can be an unexpected heart symptom, particularly in congestive heart failure. If your heart isn't pumping blood efficiently, fluid can build up in the lungs, leading to a persistent, unexplained cough, wheezing or breathlessness, especially when lying down. Swelling in the legs, a sign of fluid retention. If you notice these heart failure warning signs, get checked immediately. 8. Fainting spells, a dangerous symptom of poor circulation. If you've ever fainted or felt lightheaded for no reason, it could be due to poor blood flow caused by clogged arteries or an irregular heartbeat, arrhythmia. Fainting combined with chest pain or shortness of breath should be taken very seriously, as it could indicate a serious cardiovascular issue. 9. Sudden or excessive sweating, a warning sign of heart attack. Breaking out in a cold sweat while resting can be one of the first symptoms of clogged arteries and an impending heart attack. If sweating is accompanied by nausea, dizziness, or chest pressure, call 911 immediately. Acting fast can save your life. 10. Unexplained anxiety, a surprising connection to heart disease. Sudden, intense anxiety or panic attacks could be a sign that your heart is struggling, especially if paired with a racing or irregular heartbeat, shortness of breath, chest tightness, or dizziness. If your anxiety feels unusual or extreme, don't ignore it. Get your heart checked. Conclusion: as you age, heart health should always be top of mind. If you're over 50, it's crucial to pay attention to unusual heart failure symptoms, signs of heart damage, and other weird signs of heart disease. Regular exercise, a heart-healthy diet, stress management, and routine checkups are essential for heart attack prevention and maintaining your cardiovascular health. Heart disease symptoms often appear silently, and by the time traditional chest pain or shortness of breath manifests, significant damage could already be done. So, whether it's persistent swelling in your calves, unexplained fatigue, or even a chronic cough, don't ignore the unexpected heart symptoms. Recognizing these early signs of heart failure and seeking timely medical advice could be the key to preserving your heart health and preventing a more severe cardiovascular event.